Good morning, everyone, and welcome to the Health Committee for the County of Renfrew for October, what is the date today? The 12th at 9:30 a.m., and it is the appointed hour, so we are coming to order. With that, as we gather this morning, I wish to acknowledge on behalf of committee and our community that we meet on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We are extremely grateful for their many and continuing displays of friendship. We also thank all the generations of people who have taken care of this land for millennia. With that, Ms. Hill, has the roll been called?
Yes, Mr. Chair, roll has been taken.
Thank you very much. I would invite now committee any disclosure of pecuniary interest, and if any, the general nature thereof, please. I recognize none. Could I have a motion, please, to adopt the minutes of the previous meeting held September 13th, 2022? Councillor Lafreniere, seconded by Councillor Murphy. Committee, any errors or omissions? Seeing none, all in favor? That is carried. Thank you. Mr. Kelly, there were no delegations at the time the agenda report was circulated. Has that changed? No, sir. It has not. Thank you. With no further ado, then, Mr. Blackmore, if you would take us through the long-term care report, please.
Thank you, Chair Donahue, and good morning to you in committee. Through you to committee, the long-term care report begins on page 3 of your report. Item number 1 is the pandemic update, and since the time of this report, the last report, the Monash Manor has 2 positive cases that are not epidemiologically connected, so therefore it remains in non-outbreak status. Miramichi Lodge's suspect outbreak on resident home area 1A was lifted as of this past Sunday. The next heading describes the Public Health Ontario's planned surveillance report intended to track Ontario COVID and influenza for the upcoming year. And they've created a system, a rating system essentially, comparing weekly, issued on a weekly basis, issued at low with a less than 10% positivity rate, moderate with a 10 to 25% positivity rate, high at 25 to 39.9, and very high at greater than 40% positivity rate. And as of this past week, ending October 1, COVID is currently reported at a moderate level of 13% and influenza at low at 0.7%. So that will be the tool that we'll be looking toward in the upcoming next wave of COVID and flu season. The next item is the bivalent booster vaccine update. So far, uptake has been excellent at both homes with regard to residents, with 90% either having received their bivalent dosage or consented to do so. And we're using the Moderna variation of the bivalent vaccine that covers the BA.1 and the original Omicron. Staff vaccination clinics are underway at present. Uptake has been good thus far. The next is the latest announcement pertaining to the COVID containment funding. Committee will recall that this is the funding that we use to fund our screener positions, extra staffing for things like high touch contact housekeeping duties, recruitment and retention incentives, staffing incentives of that nature. Anyhow, the funding covers us to September 30th. As of yet, there's been no announcement made by the province for continuation of said funding. But just this past Friday, the ministry made another announcement with regard to an update to the guidance document for long-term care. Some new measures underway. So some of the more significant changes that take effect coming into effect this Friday, October the 14th, are that staff are no longer required to undergo what's called active screening, but rather are at minimum are required to engage in passive screening, which essentially is signage. But having said that, the requirement for testing remains, i.e., at minimum, all personnel, people entering the building are required to be tested no less than twice a week if their vaccines are up to date, and 3 times a week if their vaccines are lapsed. There's been a greater than 6-month lapse since their previous vaccination. As your committee is aware, both homes test on a daily basis, and it is our plan to continue to do so. For the added protection of screening every day, and logistically, the figuring out who's due when, it's just a bit of a logistics nightmare, and the fact of the matter remains is we require a screener to be present 7 days a week anyway. So with that in mind, it is also our intention to maintain the active screening as well. Since the screener's there, it's really a minimal disruption to staff, and that we have an app that staff complete in a matter of seconds. So we'll be maintaining the active screening. Something that's new is residents returning from an absence are no longer required to be tested unless symptomatic. There was a limit for no more than 4 visitors at a time in the home. That's been lifted now. There's no limit. Masking is still a requirement for staff, visitors coming into the home. A bit of a change in that the ministry is recommending that allowances be made for residents and visitors of residents to be able to unmask in the residence room for purposes of, well, it's been over 2 years, and residents, been some time for some of them since they've seen their loved one's face, and it really, wearing a mask limits the opportunity to engage with eating and having a drink. So we'll be instituting that. The proviso is those residents that have a shared room, the mask, you could only unmask when the other resident's not present or staff enter the room. Our vaccine policies remain in place. The ministry was silent with regard to any changes to vaccine policy. It still remains, still recommended to have your vaccines, and for homes to engage in their own vaccine policies, which we'll get to later on in the report. The next item is Ipac training and education. So this is additional new Ipac funding in addition to the funding that was provided to hire Ipac professionals, which both homes were successful in being able to do. This additional funding is specifically for training. One of the things that the government has promised to provide funding for is Ipac certification training, additional training up to $4,100 per Ipac professional, or other staff interested in taking the course as well. The next item is an update to the temporary retention initiative, just with regard to final payments being made shortly. The next item is a Statscan report on the impact of COVID-19 in Canadian nursing homes for the year 2021. Where it reports 2/5 of Canadian nursing and senior homes had at least one resident with COVID. And I find that statistic to be shockingly low, to be honest with you, given the prevalence throughout the county and in Ontario. And in fact, when you dig deeper into the report, isolating Ontario nursing homes specifically, that figure is 57%. And yeah, it was reported that over 50% of homes indicated that staffing was that much more difficult in the year following 2020, which comes as no surprise. Next is a report. Next in the report is an overview of Bill number 7, More Beds, Better Care Act, and its implications for county homes. As committee may be aware, significant measures have been employed to expedite the discharge of patients better suited for long-term care in an effort to free up hospital beds. What's new is patients may now be slotted for placement not in a long-term care home of their choosing, and sometimes at a distance. Ultimately, certainly a patient can refuse to be discharged, but that comes at a cost of $400 a day to do so. Just for the committee's interest, to date, neither county home has received such admission. Item number 2 describes the latest efforts from both the Ministry and the College of Nurses Ontario to bolster RN and RPN retention recruitment in the face of what's at times been described as an exodus from the profession. So looking at expediting the registration process for foreign trained and former nurses, and remove some of the barriers for temporary class registration. Item number 3 is the summary of a Ministry of Long-Term Care inspection conducted over 6 days on site by Inspectors Bouness and Punzalan between August 18th and August 31. 3 written notices were issued. The first 2 findings were the result of an allegation regarding a staff member neglecting to perform incontinence care on a night shift for 5 residents and a failure to notify family within 12 hours of the allegation. Investigation was conducted. The staff member in question is no longer employed at the home. And certainly reminders were put out. Families were notified, but it was after that 12-hour period. Reminders were issued to nursing leadership with regard to the requirement to do so. The 3rd notice was issued related to a failure to follow a resident care plan, where on the occasion of being short-staffed and with competing priorities underway, a resident was not returned to bed as was indicated in their care plan, but was rather left in their recliner for a period of 2 hours. Anyhow, we tried to argue that it was a matter of prioritizing duties for the day, but nevertheless, a notice was issued. Item number 4 details the recent and long-awaited announcement for more nurse practitioner funding for long-term care, with an intent to recruit 225 nurse practitioners over a period of 3 years. As committee will recall, both Bonnechere Manor and Miramichi Lodge are very fortunate to have a nurse practitioner employed with us for over 22 years now. And we're in the process at present of applying for funding such that each home will have their own designated nurse practitioner. And as far as funding is concerned, at this time it's just been identified as being for the 3 years. Hopefully, I mean, it's been a history, and such initiatives have come through in the past. By way of example, the RPN fund, which was announced and continued on an annual basis to the point where it eventually, that funding got rolled back into the nursing and personal care envelope. So not to say that's what's going to happen, but hopefully that something like that would continue to occur beyond 3 years. The next are resolutions. Chair Donahue, or should I just...
Thank you, Mr. Blackmore. I think that's an appropriate spot to pause briefly so that we can, as committee, can review the information items. So with that, committee, take you back to page 3 of the report and information item number 1. And I will, in fact, break it down by emboldened headlines as the COVID-19 pandemic update continues to be fairly expansive. So with respect to the outbreak status, and thank you to Mr. Blackmore for bringing us up to speed once again. The outbreak status does seem to change almost on a daily basis, but certainly pleased at the current status, though that could change by afternoon. Any items, any questions, comments on the home outbreak status? Any comments on the new Public Health Ontario report? The bivalent booster update. Councillor Lafreniere, please.
Just a question in regards to the actual booster. Does someone need 3 doses of the prior COVID vaccine to get it? Or And also, can someone who's not vaccinated at all get this booster? Do you know?
I might actually, I'll take a stab, but I will certainly deflect to perhaps the paramedics present in the room who have been part of the administration. I think it's referred to as a booster mostly because the expectation is that individuals have had those previous, but it is a vaccine unto itself, as I understand. That I don't think that there is any requirement for having the primary series, or what is referred to as the primary series, which is the first and second doses. I do note that with any of these boosters or vaccines, generally speaking, no, it would only be with respect to boosters, that there is a gap that is preferred to have the largest response to the vaccine administered. But outside of that, I certainly would defer to perhaps the chief or deputy chief, as Chief Nolan, you see fit.
Thank you, Mr. Chair. Yeah, I support your observations on the issue, and I don't believe that there's any prerequisite from the previous versions, and that essentially it's the latest and greatest. So if you haven't had ones before and you've changed your mind about vaccines, then this is a reasonable and safe way to go. And if you have had previous vaccines and are choosing to have another, then this is, by all intents and purposes, a safe option and gives you the best coverage to date based upon the new and improved science associated with COVID and its variants.
Yeah, thank you very much. That might give confidence to anyone who hasn't been previously vaccinated to know that, it's been how many years now in the making, and that this is apparently the best one out there. So thank you.
Yeah, and just to add to that a little bit too, so I did avail myself of a clinic, and I can't recall the date, I believe it was in August, at Mattaway Recreation Facility in Renfrew, wherein I received the 4th dose. And at that time, the bivalent, neither the Moderna nor the Pfizer had actually come out or had received approval. There was an engagement by, and I believe it was a paramedic that administered the vaccine to myself and my wife, that acknowledged that should we receive this now, that the recommended interval before the bivalent would be 6 months, and left it up to us to decide whether we wish to wait for the bivalent or go ahead in the event that we did get the 4th shot. So it puts us into, I think, December before that 6-month interval. So hopefully that also reinforces. I'm going to actually pick up on something that the chief said, and I would encourage all of those, whether you have been vaccinated or not, that this is a very effective means at reducing significant or serious outcomes, which is not to diminish outcomes that many have experienced, but there is no question at all that the vaccine has diminished the burden, the health burden, both individually in terms of the severity of illness, but also the impact on hospitals. Anything further? Chief Nolan.
I was reminded by Deputy Chief Leahy that there is a 90-day wait window between having COVID and receiving this vaccine. So just as a reminder to people, in case they're pondering their choices, should you have had it, you have to wait 3 months before you're eligible to receive it. Thanks, Brian.
Thank you, Chief Nolan. Thank you, Deputy Chief, as well. Anything further on the bivalent booster? Questions on the prevention and containment funding update? On the Ipac training and education funding? On the long-term care temporary retention incentive for nurses update? On the Statscan report vis-a-vis the impact of COVID-19 on Canadian nursing homes? Bill 7, implementation to support Ontario's plan to stay open, health system stability and recovery. Warden Robinson, please.
Thank you very much, Chair Donoghue. Just a thought came to my mind. So if there's folks right now that are in an alternate level of care bed in the hospital, we also have people that and families that are at home desperately trying to support their loved one waiting to get into a long-term care facility and on a wait list. Does someone who is in an alternate level of care bed bump to the top of the list as opposed to someone who's in their home, supported by family, and waiting to get into a long-term care facility?
Mr. Blackmore.
Warden Robson, through you, Chair. Yeah, that priority is determined by Health Community Services. I could say that our most recent admissions have been from hospital versus community. I can't say for certain which trumps the other in terms of priority. I think at the moment, the hospital, depending on the hospital, the situation looks like it's the priority at the moment.
Follow-up, Warden Robinson.
Thank you very much, Chair. And that's suddenly what I started to fear, because I know when COVID was rampant and we shut down any admissions to our two homes, I received a number of phone calls from families absolutely desperate. Now, thankfully, that the province saw clear to fund the community paramedic for long-term care to support families at home. But I would be curious, and I think we should pay attention to the fact that if it's alternate level of care bed folks that are getting those beds in our long-term care facilities, that we're going to have to really maybe pay attention to the demand that's happening on our paramedics for our long-term care, and perhaps starting to advocate for more assistance in that. I believe that everyone should be able to stay at home safely if that's their choice. So I just need to think that I just want to make sure that if we're seeing that happen to folks, and sometimes people who are very busy just struggling to survive day to day don't have the energy to advocate or to complain. They just move forward. So I think it's our job to watch that and to assist and make sure that the province is aware of the impact that Bill 7 is having on people who are still staying at home.
Thank you, Warden Robinson. I certainly I think that we are, and I have stated it in this room before, the warning signs have been there. The alarm bells have been going off for some time. This isn't something that just happened within this term of government. It's been going on for at least 20 years. It seems absurd to have thought that the baby boom generation that has so impacted every phase of life from the time that they first began in 1946 through their entirety, it was absolutely foreseeable that we were going to get here. So that heads buried in sand over the last quarter century has not actually been a solution is hardly surprising. That we find ourselves at an inflection point that is somewhat draconian, where the supports we have experienced, where the home supports have not been there. It is one of the driving factors that has brought about such innovation in the community paramedicine program, which is the long-term care at home. These are things that should have been put in place ages ago, that we're now actually charging hotel rates for those who don't have the support at home, whose families don't have the capacity to support them at home, and yet are in hospital not at all where they wish to be either, and now to be faced with this sort of charge. It is absurd. The other thing is, I had read somewhere recently, I believe it was Tom Clausen, who was, I believe, formerly the CEO, perhaps, of the University Health Network, that had correctly identified that there are the enormity of wait lists that already exist at long-term care. Where do we suppose we are going to find the homes for these people in alternate level of care that also have no access or poor access, at best, to the support that they absolutely need at home? So I'm 100% in support of your comment that it is incumbent upon us to continue to shine a bright light on this, and to recognize that a problem that has been 25 years in the making is not going to be solved overnight, nor is it likely to be addressed by ham-handed policies that are being put in place now that have probably small likelihood of making much of an impact on the situation. So we will absolutely keep a very close watch on that. Anything further on this item? Moving on then to item 2, the College of Nurses of Ontario taking action to change regulation. Item 3, the Ministry of Long-Term Care inspection reports for Miramichi Lodge. Item 4, the Ministry of Long-Term Care announcing new nurse practitioner funding. Councillor Murphy, please.
Thank you, Mr. Chair. Through you to Mike. I think that this funding announcement is amazing. Does the ministry have an idea of where they're going to find these? And I knew that you were going to laugh, but I have to ask, do they have a plan? Like, I think incentives are great and putting aside money provincially is great, but if we don't have the talent, I think the retention right now is as important as recruitment.
Mr. Blackmore, please.
Through Chair Donahue to Councillor Murphy. Yeah, recruiting for nurse practitioners has been tough at the best of times, even, where there was limited hiring underway. I mean, certainly it took a while for us to get our most recent nurse practitioner for both homes. I know over the years there's been an increase in the spaces available to train nurse practitioners, and there's funding available. In the past, I'm not sure if this is something that's ongoing at present with regard to providing tuition assistance and what have you. I don't think that's the case at the moment. But to me, I think that's something that needs to happen with regard to recruiting and training those very NPs that we're hoping to hire at 225. It's going to be a tall order. And that's 225 specific for long-term care, for which not all nurse practitioners end up working in long-term care. So, that further it makes this a greater challenge.
Follow-up, Councillor Murphy.
If I may, Mr. Chair, so the answer is no. They actually do not have. I just wish that when they come out with these funding announcements, I wish that there was some teeth behind it. It's exactly what you just said. Tuition incentives, maybe second career, using immigration. I just think that there are ways to promote and get people into the long-term care homes, but I wish that there was a plan that came along with this, $57.5 million. Thank you.
Thank you for the question, Councillor Murphy. I think that it's perhaps the salient point is health human resources has been such an enormous challenge for the entirety of my tenancy in this room, which is now 8 years. I know it's also is part of Mr. Blackmore's report that we are just about to view with respect to part-time, full-time, that there does definitely need to be some kind of a plan. Actually, even providing the money is of little support and value if we don't actually have the people engaged in that particular sector that we absolutely need. With respect to funding, what I would submit is on the 23rd of September, the province announced $2.1 billion surplus. So in terms of where the dollars are going to come from, there is a $2.1 billion surplus. I do wonder perhaps if some of the federal COVID monies might be comprising some of that $2.1 billion. There seems to be some mystery surrounding how much of that has been allocated. So I do believe that the funding is there. The challenge, as you have noted, as Mr. Blackmore has noted, is in fact engaging individuals to enter this sector. That is where the tremendous need is. Warden Robinson, you had a question.
Oh, I just have a comment. I had to weigh into this. So it wouldn't, like it says $57.5 million, and it may as well be $1 billion. That plays well. It looks good, but it's just like having incentives for physicians to come to underserviced areas. It says it looks good on paper. People are not coming to these areas because there are no bodies. They talk about the increase in the number of long-term care beds. You can build it, but who's going to work there? It's going to be a building with a whole bunch of beds and people thinking they're coming and no supports. So it's just it looks good on paper, but they'll never have to spend that $57.5 million.
If you build it, they will come, and in this instance not, and in fact the farm would have been repossessed in Iowa, and Mr. Kinsella and his family would have been turfed out on the roads had the dead ball players not showed up. So if you fund it and they don't show up, collapse is imminent. Anything further? Seeing none.
Does anybody else want to know how many times Michael's watched Field of Dreams?
The chair did not recognize Councillor Murphy. You are out of order. Thank you. Moving back to you then, Mr. Blackmore, for resolutions.
Thank you, Chair Donahue. Through you to committee, item number 5 is a resolution presented as a Bonnechere Manor business case seeking to convert part-time RN hours to a full-time position. We currently have 2.78 full-time equivalents of part-time RN, and if this business case about to be presented is approved, there will be 1.78. Recommendation that Health Committee recommends to County Council that the full-time registered nurse complement at Bonnechere Manor be increased by 1 position of 1,950 hours from existing part-time hours effective November 6, 2022, in an effort to facilitate recruitment and retention. As background, the registered RN position plays a critical role in the residents' health and overall well-being. As part of the home's interdisciplinary team, the RN assists in delivering personalized care while meeting regulations to ensure overall compliance with ministry standards. An additional full-time RN position will assist in ensuring adequate coverage within the registered nursing department and assist with the consistency and quality of services as well as employee retention. Currently, Bonnechere Manor has 6 part-time vacancies, and recruitment for these positions has been an ongoing challenge over the past 2 years. Increasing the full-time complement is consistent with the provincial long-term care staffing plan as well as the Commissioner's recommendation as a means to promote more stable working conditions and reduce the number of individuals working multiple part-time jobs. The business case is attached as Appendix Long-Term Care 1.
Thank you, Mr. Blackmore. Could I have a mover, please? Councillor Murphy, seconded by Councillor Grills. Any question, comment, discussion on the full-time registered nurse resolution? Just one question, Mr. Blackmore. You've identified in the report 6 full-time positions that we have struggled to fill. The one full-time position is expected to displace some of these. What would be the FTEs or the full-time equivalencies of the 6 part-time that we anticipate, should we successfully recruit for this position, could displace?
Thank you, Chair Donahue. Through you to committee, the current FTE of those 6 part-time is 2.78. And combining would essentially 2 positions to make 1 would bring that down to 1.78 FTE. And the reason for those having to not being able to convert all into full-time is for staffing purposes, for weekend coverage, vacation coverage, those types of things. You do need a number of part-time staff as well.
Okay, thank you. Anything further? Seeing none, all in favor? That is carried. Thank you. Moving on to item 6 then, please, Mr. Blackmore.
Thank you, Chair Donahue. Through to committee, item number 6 is a recommendation further to strategic plan goal number 3 pertaining to the long-term care homes policies and procedures, specifically the continuation of the COVID vaccination policy for both county homes. A recommendation that Health Committee recommends to County Council that policy G010 vaccination policy for the long-term care homes remain applicable until March 1, 2023. As background, committee will recall the presentation of long-term care homes vaccination policy, the Special Health Committee held on March 28, 2022, and the updates provided at the May 11, June 15th, and August 10th, 2022 Health Committee meetings. Staff is recommending that the long-term care homes vaccination policy attached as Appendix Long-Term Care 2 remain valid until March 1, 2023 in consideration of the prevalence of the Omicron variant and risk posed to vulnerable populations. A recent survey of Eastern Ontario municipal home administrators identified that homes are maintaining the status quo where mandatory vaccine policy is concerned.
Thank you, Mr. Blackmore. We now seek a motion, a mover, please. Councillor Frenier, second. Councillor Bennett. Any discussion? Seeing none, all in favor? That is carried. I believe that is the full long-term care report. Could I now seek a motion to accept the long-term care report? Councillor Emo, seconded by Councillor Murphy. Any further and final opportunity for question on any component thereof? Seeing none, all in favor? That is carried. Thank you. With that, I think that we're doing quite well. I think that we will go directly into the emergency services report. With that, Chief Nolan, you have the floor.
Thank you, Mr. Chair. I put a little Field of Dreams on here for you. If you can hear that. Can you hear that, Jen? Little Field of Dreams.
We're not in the meeting.
It pales in comparison to Remember the Titans, to be quite honest.
There you go. Well, of all the meetings in his 8 years here, it's probably a good one to celebrate everybody's involvement. So a little Field of Dreams seems appropriate this morning. I'll see how Craig feels about that after the meeting. Item number one, Mr. Chair, through you to members of committee, is related to a presentation that Amber Haltink. So Amber's the commander principally responsible for community paramedicine. And as you know, for many years now, we've been working with the German Rescue Service, which is principally the Bavarian Paramedic Service, and Ringsburg specifically, which is a town and a county within Germany, which effectively mirrors our own. And they've been here on a number of occasions. I've had some of my staff visit their service in the past, and they have implemented a community paramedic program that mirrors ours for their community. And it's the first of its kind in the Franco-German world of paramedic practice. We're pleased that Australia, New Zealand, Ireland, and a number of other countries have worked very closely with us as well in the kind of the, how would I put it, sort of the English-speaking world. And so I'm very pleased that they had invited Amber to present our program to all of the German rescue service, which is they consider their paramedic service, and share our experiences. And I have also been working with them on a sister agreement so that they can send paramedics here, like frontline paramedics, to come and view and participate in our community programs, and they've opened the doors for us to do the same. So very pleased that that is continuing and that there's an acknowledgement of sharing information and resources back and forth. Item number two, related to the Virtual Triage and Assessment Center, very pleased, as I believe we spoke at council, to remind committee that we won the 2022 Community Impact Award of the Upper Ottawa Valley Chamber of Commerce Business Excellence Awards Gala for Renfrew County. And the second paragraph is probably of equal importance, and that each of the awards were judged by executives from across Canada, not Upper Ottawa Valley. So really the acknowledgement of VTAC, the leadership of the warden, the chair, all of council, and the city of Pembroke to make that possible, as well as all the partners who have made VTAC what it is today, from our health system partners, hospitals, public health, right on through to community mental health agencies and the like. We're very pleased that that we are recognized for that work. Certainly that's continued with Cheryl Gallant and MPP John Yakubuski also extending their congratulations, but really it's a testament to the medical receptionists, the physicians, the community paramedics, and the community as a whole for allowing VTAC to serve our population at large, but specifically provide an option for those who do not already have a family physician to be able to access a service which is as much life-saving as any other part of the health system. And that is certainly a vulnerable part of our population when the only options that are available to you in the absence of VTAC are to call 911 or go to an emergency department for the simplest of health concerns. So knowing that we now have a third door open for people in Renfrew County is absolutely invaluable and really was a big part of the recognition of this award. So thank you to the warden and the chair and all of you for your unwavering support of VTAC over the years, and very happy to have this crowning achievement. I think the only thing that would make the warden happier right now would be a letter from the Minister of Health to say VTAC is here to stay, keep doing the great work, and we're going to continue to push on that as we go along. So that will not be forgotten. This, I think, just continues to add credence to the value to the Chamber of Commerce community at large, but more importantly to the people that we serve on a day-to-day basis, knowing that I believe now we've served over 80,000 patients through this system. 60,000 was our spring number, and I'll bet you we're eclipsing 80,000 now. So when we talk about force and numbers, this is a very valuable service that we're going to continue to support going forward. Item number 3, Mr. Chair, related to Ministry of Health long-term certification. So this is like the accreditation process that the homes go through. They come and see us every couple of years. They have to give us 90 days notice, which they just provided us. And now it is all hands on deck to go back through all of our policies, all of our procedures, and just evaluate their compliance with the changing legislation, regulations, and requirements that the province puts before us. So I'm very confident that we will do well, as we have in the past. We're often a favorite service for these teams because paramedics and managers and chiefs from across the province get to put up their hands on these certification reviews and go see different services. And I know that we're a bit of a head scratcher to some in terms of the breadth and sophistication of the programs that the paramedics here are running, from the 911 system and the tools that we're using and the way that we care for people, right on through to some of the more innovative programs such as VTAC and our community paramedic models. So we welcome the province to come and have a look, provide us some feedback. We'll continue to build upon those experiences and continue to evolve the service so that we can provide reliability and quality at a good cost for our population, and that's always the balance we're trying to strike. Item number 4, we are in Barry's Bay today with the Sierra team, or part of the Sierra team, doing an exercise with St. Francis Memorial Hospital, which is related to a chemical, biological, radioactive, or nuclear decontamination. And that all might sound very extreme, and you might be thinking of Russia, and you might be thinking of lots of things. But for those of you that have been in cancer treatment, there are certain chemicals, there are certain realities that come with healthcare that check every single one of those boxes when we're dealing with health sector, let alone any major catastrophic incident. And whether you're dealing with a cancer drug or you're dealing with a warhead, the same process applies. Whether we're participating with our friends in Chalk River or dealing at a very micro level with a truck that tipped over on its way to be processed in another community. These are all of the assurances that our team continues to exercise. And we're very grateful that St. Francis has stepped up. And interestingly, our partnership with St. Francis goes beyond today's exercise in that they received a shipment of equipment, well, that rhymes, from the province many years ago, tents and decontamination shelters and so on. They provided that to us so that our team can use that across the county, of course, based upon an assumption that should they have a problem, we're going to show up there too with their stuff. So we've become the experts as the Sierra team, and obviously work very closely with our partners in fire and police and other agencies to be able to maintain a level of readiness for any of these circumstances. Another, very relevant example is sort of the biologic component of CBRNE, which when you think of the swabbing and the doffing and donning and personal protective equipment and poppers and all of the readiness that we undertook throughout the drive-through swabbing and all of that, those were all very good examples of the type of work that the Sierra team has created and expertise in. So I'm very proud of that. And we'll see how today's exercise go. Item number 5, related to Exemplary Service Awards, Paramedic Jan Farrell and Paramedic Jerry Slobosian both received honors from Canada's Surgeon General this past week in Niagara Falls at the Ontario Association of Paramedic Chiefs Conference. And in that, they received their medals for exemplary service, which is a very high honor. It's not a long service medal. Each application is evaluated on its merits, that they made an exemplary contribution to Canadians throughout their career, you had to have had at least 20 years of consistent meritorious service to be even qualified. And then from there, the heraldic or Governor General's process evaluates the eligibility for those awards. So very pleased. We will be getting some photos back from the event and sharing those photos. And should the warden, chair, or CAO of the day wish to have paramedics Sloboshan and Farrell at a future health committee meeting so that we can congratulate them on this award, I'd be happy to facilitate that in the months to come. So we'll see what that brings. Item number 6, Mr. Chair, is related to the emergency services race. So as we talked about throughout the pandemic, we look forward to opportunities to be able to come together as emergency services in the community. Deputy Chief Grenier is at the back of the room and was one of the pioneers of establishing an emergency services race and including nurses and right across the emergency services space, but also having families and friends of emergency services come out. And we raised over $1,000 for the Phoenix Center. So as our friends in finance have done, they've netted off a few $100s for the expenses associated with the event so that it was cost neutral to the county, of course. But we're very pleased to be able to provide a check to the Phoenix Center for the great work that they do. And as you know, the Phoenix Center, in its relationship even with VTAC, has stepped up throughout the pandemic, knowing the mental health challenges facing our community. And we believe that that was an important service to be able to support in our community. Item number 7 related to capital assets, and Deputy Chief Leahy's here if there are any questions about this, but I don't think it's any surprise to you that over the pandemic there have been a short supply of many different things. Right now it seems to be children's Tylenol and children's Advil. Yesterday we couldn't get Polysporin eye drops either. So it's a very random event. But one thing that's very consistent out there is vehicles and their microchips are in short supply. So despite the fact that in 2021 we had ordered a half-ton truck to replace a half-ton truck and expeditions and so on, the vehicles that are available to us are Chevy Tahoe half-tons, and of course these are vehicles that are eligible to be fit up as emergency response vehicles through our suppliers. We go through a sole source process because there is one supplier to be able to provide ambulance products within Ontario, meeting the certification requirements. So we have accepted 3 vehicles, I believe, Brian, at an equal cost or within that same funding envelope from the original budget submission for the emergency response vehicles. So just so you're aware, we are anticipating significant increases going into next year's budget on our ambulances and on a number of other vehicles, which is part of the reason, as you may recall, we rented a number of half-ton vehicles throughout the pandemic, paid for in part by the community paramedic program and also through COVID-related costs, because we haven't been able to get rubber on the road. And we are very likely somewhere between 1.25 million and 1.5 million kilometers a year on our vehicles in the fleet. So we are very fortunate in that we use the Mercedes Sprinter as our ambulance chassis, which is the only ambulance chassis that's been available since the beginning of the pandemic. So we have not previously had challenges. However, we have received notice that not only are they going up in cost, it's going to be more difficult to get future shipments of those, not because the vehicles aren't available, but because the manufacturers have laid off staff to be able to upfit those vehicles. So it's a little bit ironic that we've now got vehicles sitting on the ramp, if you will, and not able to yet put them in service. So Brian's expertly navigating those relationships, but we're not going to be able to pull some things off within this budget year, and we're going to have a chit-chat about what that represents in terms of a rollover capital pressure into next year. Item number 7 related to the community paramedic program. This seems to be Amber's report. She should be here giving it today. She's done an exceptional job in terms of her community engagement. And there are a few examples of where Amber has been representing you and the service, ranging from the Eastern Ontario paramedic chiefs, where we've created a separate stream historically for each of the meetings that we would have amongst the chiefs from Eastern Ontario and Kingston. So it would be the equivalent to the EOWC, for example, amongst the paramedic chiefs. One meeting we would have the operations deputies come and deal with operational deputy issues, and the next one would be quality. We've also now added a third stream for the community paramedic commanders to come together and to be able to share, which I believe is in alignment with the vision of the EOWC in terms of finding efficiencies, creating opportunities for consistency in our application. And of course, we use that as an opportunity to also share the merits of VTAC and our integration between community paramedics and that service as well, to just try and share that information. So Amber's been working with Matthew very closely on that, as well as palliative care seminars and with the dementia network on the Dementia Network Housing Roundtable, and work very closely with public health. So, kudos to her and the work that she's been doing in that regard. So, Mr. Chair, that concludes the body of my report. I do have a few resolutions, one resolution, one bylaw. How would you like me to proceed?
I think we will review the information items, and then we will approach the resolution and bylaw each separately, but we will review the information items now. So, committee, if you wish to return to page 22, information item number 1 of the Emergency Services Report is the Renfrew County Community Paramedicine. Item 2, the Virtual Triage Assessment Center Community Impact Award. Warden Robinson, please.
Thank you very much, Chair, and thank you to you and CAO Kelly for attending that night. Unfortunately, I was not able to attend the gala, nor was our paramedic chief, but Matthew was there, I understand, so that's great. I think you're taking photos, but it was all good. So yeah, I mean, what would make me happy is a letter from Minister Jones. I did send her a letter 2 weeks ago offering a number of dates that I'm going to be in the Toronto area, and have just reached out actually to MPP Yakabuski, telling him that we will come any day, any time to meet with her. I've got 42 days left, and I absolutely refuse to be a lame duck until the very last day. So we'll see what I can do.
Thank you, Warden Robinson. I must acknowledge how privileged I was to have received this award. As Chief Nolan has said, the principal photograph, I guess, provided by Mr. Butler shows 3 of us, myself and Deputy Chief Grenier and CAO Kelly, but the army of people that are behind that I was simply a figurehead, as all of us were, that this has been an enormous lift and a very comprehensive engagement that I think speaks volumes to how the community has to participate in something that is going to meet their needs and to become so successful. So it was an absolute privilege to have been present for the award. And I will note that the evening of, I had suggested, as Mr. Grenier and I were climbing the stairs onto the stage, that it was like the Sunday afternoon matinee on Broadway where the understudies got to shine in place of the warden and the chief. And also pleased to have had Mr. Kelly just embarking on his tenure as CAO of the County of Renfrew, setting the stage moving forward. That this is imperative, as you say, by whatever means are required to convince, to finally make that compelling argument that provides us that certainty of ongoing and permanent funding. Very much looking forward to that. So thank you, of course, to the Upper Ottawa Valley Chamber of Commerce, but thank you to all of those individuals, those allied health sector, the folks behind this. We were standing on a lot of shoulders to accept that award. Moving on to item 3, the Ministry of Health and Long-Term Care certification. Oh, sorry, I was remiss. I know that Councillor Lafreniere, you had a question or comment on item 2.
I just want to commend anyone who was around the table or was in a leadership position, such as I believe the chief, when the seeds were planted for VTAC. And I commend it. I mean, we're all benefiting from its harvest now. I just want to say, though, that we really still need to boast about this one loud and clear, because there's still people out there, talking about we need to get doctors. Well, you know what? We all know that that's still an issue, but we really do need to celebrate our triumph and get the word out even more, because there's still people out there that don't know what VTAC is, and I'm still telling people about it that say they don't have a doctor, especially newcomers to the area. So congratulations. It's still growing, and that's all I wanted to say. Thank you.
Thank you so much, Councillor Lafreniere. Item 3, once again, the certification for the ambulance paramedic service. I'm reminded when Chief Nolan had commented that the innovation here that makes this particular certification of the County of Renfrew Paramedic Service perhaps a destination of choice. And I do know a few years back when I had dropped in on another farm with an intent of making a purchase, and the young fellow that was there advised Mr. Donahue, if you want to talk to me, you have to walk with me. And I think that that's probably the case with this certification. Is you're welcome to come and certify us, but you're going to have to come up to the speed at which we operate, else you're not going to get a very good image of what we do here. So I think that is testament actually to the dynamism within the County of Renfrew Paramedic Service. Item 4, emergency management and the exercise at St. Francis. The only distinction that occurred to me, Chief Nolan, is with this nuclear, there's not that boom factor associated. Item 5, the Exemplary Service Awards. I think that it is a capital idea, Chief Nolan, that paramedics Jan Farrell and Jerry Slobosian do indeed come to be recognized and celebrated for their exemplary service, that I would certainly recommend to Mr. Kelly that be given consideration in the new term of council, given the timing of this council now. Item 6, the emergency services race. Item 7, the capital assets. Not a question so much on the carryover that was clearly identified at the budget process, but I am, and these are the community paramedicine type of vehicles. So for 2022, we had also budgeted for the replacement of 6 ambulances. And I'm wondering if we are experiencing any acute issues currently with our 2022 capital program. Deputy Chief, please.
Thank you, Chair, through you to committee. As recently as last week, our vehicle manufacturer, who you rightly mentioned to committee, is a sole source provider in the province of Ontario. There is only one diesel chassis available under the certification program by the ministry, and that is a Mercedes diesel, and Demers Ambulance is the only manufacturer of that vehicle. We enjoyed an early receipt of product last year because no one had caught the Sprinter bandwagon yet. There was still some lag to the Ford, Chev traditional lineup for paramedic service vehicles, ambulances in particular. And we, fortunately, with our Sprinter inventory, didn't experience that lag. The microchip problem wasn't a problem across the ocean where these vehicles ultimately come from. However, with Ford and Chev now, still somewhat in a lag position. Others have caught on to the fact that from UPS to Purelator to whoever are seeing that Sprinters were more readily available than the North American products, so they've taken away a lot of the chassis that we previously enjoyed. So all that being said, this year we were notified that there will most likely not be a receipt of our 2022 lineup within the timelines, and Mike mentioned that earlier. However, it shouldn't be significant. Our challenges continue to be with the emergency response vehicles, which we still are in the North American lineup for those. Our 2021 order is still not on our doorstep here, although shortly it should be. So we do perceive upcoming that we will have those lags which impact our capital assets sheet, which isn't really a fluid document other than the year upcoming. And the expectation is that we've been told to expect delays. Chief Nolan also mentioned earlier, or perhaps it was Chair Donahue, and they were accurate in the fact that the tooling back up these assembly lines has been a challenge because they've laid a lot of staff off. They tooled down to 3 days a week, and trying to tool back up is a challenge because everyone's gone to work elsewhere. So much like Mr. Blackmore experiences challenges in getting staff in his sector in the hospitals as well, getting staff back through the door to get these vehicles put together has been a challenge. So all of those things combined have us expecting delays in receipt of product.
Thank you, Deputy Chief Leahy. I think as you were explaining that, certainly I think the first thing that got onto everybody's radar with respect to both the ramping down and the ramping back up of business due to COVID was probably the airline industry, airports, et cetera. That was much in the news. What it certainly has demonstrated is while we are capable of doing the ramping down and ramping up, it takes a great deal of effort of pressing on the bellows to get those embers back into full flame again. So we are continuing to experience this, and certainly the paramedic service and the vehicle acquisition is part of that. Anything further on the capital assets line? Item 7, the community paramedic program, and Commander Hulting's presentation. Councillor Lafreniere.
Not specifically about this, but there is a mention here of housing and improving current housing, and I believe that is referring to the dementia support. However, on a side note, housing, as we all know it, is an issue across the county right now. I mean, no one predicted the pandemic's effect on real estate and the changeover in types of residency in a lot of previous apartments and now becoming homes, and people getting evicted, et cetera, et cetera, et cetera. Why is that? Why am I bringing that up here? Because I think that this is the health committee, and there's a huge component of health, mental health, when it comes to homelessness that people are not understanding. It's not as easy as building new units. It's about getting help for these people that are suffering from mental health and addiction. And something we haven't heard in a while here is a report on how that is affecting our paramedic service right now. There's more people living on the streets, as you know, I don't know, as you may know, the people living under the Mary Street Bridge in Pembroke. And these are people that have come from all areas of the county now that find themselves without a home, and they're suffering from mental health or addiction. How is that affecting our paramedic service? And has there been an increase in calls for things like, opiates? We talked about the overdose rate earlier this year. Can you report on how this homelessness issue is affecting your service?
If I might, I will invite Chief Nolan to comment. I would ask, certainly, and I think a very salient question. This is a large concern in our communities broadly. But if the answer could be restricted to this, I want to be careful about extending out into opiates, et cetera. That is not what is part of our agenda today. I know that is a burden that is growing, but perhaps germane specifically to the component with respect to housing that was identified in this report, please.
Sure, if I may, Mr. Chair, and I'd also invite Laura Lapine, who's at the back of the room, should she have anything to add at your discretion, Mr. Chair. Without a doubt, as it relates to homelessness and mental health, there is a rise, a sharp rise, in the consequences to both personal health, to how the system is and is not set up well in terms of supporting those individuals. And it also goes back to the comment made earlier regarding the lack of attached patients to primary care physicians. So where we have a segment of the population whose living arrangements, whose mental health, and whose lack of access to the health service, directly to your question, that does place a significant pressure on the paramedics and the paramedic service not only from a response perspective, and I won't get into the whys, because I think we're all quite enlightened in terms of the reasons that marginalized populations have a disproportionate use of health services such as the paramedic service. And sometimes that's disproportionately high, and sometimes it's disproportionately low. So if we were to look to our friends in Hamilton, for example, they have a component of their community paramedic program which is directly pointed at their homelessness population. In fact, dedicated to the homelessness population, because while they may have greater health needs, often those with mental health and mental health crisis are less likely to engage institutional care for all of their own reasons. So the community paramedics that we have here are befriending, are checking in on, and are present in the community, boots on the ground with this population. I don't believe that the size of the population from a homelessness perspective warrants a strategy such as Hamilton or other communities where that constitutes their most vulnerable population, where for us it's typically seniors with complex chronic disease, but we are well aware of it. We are also working with the police and the situation tables to better understand how people have arrived, what challenges they've arrived with, and what services are available, such as the Phoenix Center and others, that we can connect people into so that they can use the expertise of the community and social service sector and hopefully not need to draw down on the paramedic service because the complexity or the acuity of their illness has not met that threshold. We want to keep them well. We respect their choices. But often people are left behind because they don't have an address or a phone number or the health literacy to be able to use the system to their own advantage. And in the absence of having access to a primary care physician, we know what the options are in the absence of VTAC. So VTAC unto itself has become a partial solution for that population where there is trust, where there is access, and where we can remove as many barriers to care as possible. We follow, that principled approach with all populations, but that population in particular tends to have complex social issues, and that's where Laura, I think, and her team will reach out very actively to those who are homeless in an attempt to provide them temporary shelter and provide them access to those other supports. But Mr. Chair, I think it's a timely question given the extraordinary burden of mental health. I'm sure Councillor Emo and his other work is sharing in those experiences. And frankly, it's very sad that that's where we are at. And it's not only those without a home that are feeling that way. We know behind many closed doors, the paramedics are engaging people for extraordinary rates of mental health crisis, and the secondary effects of that, whether that be abuse, whether that be the tearing down of social structures within our community. It's what we tend not to like to talk about, but it's critically important that we do.
Thank you. Sorry to take you a little off topic, Chair, but I think it's something going forward that we need to lobby. I know the upper levels of government were talking about additional funding for this type of mental health and addiction, and we need to press them, and we need to say, we're small communities. We don't have centers where these people can get help, so we need to start to advocate in the future. And I know that Laura and her department, like they have homelessness initiative. I know you have many different funds, but I really do think they're Band-Aids at this point, and the upper levels of government need to identify that. That's all. Thank you.
Thank you, Councillor Frenier. I think perhaps through your colleague, Councillor Giacono, perhaps at this afternoon's committee meeting, it could be addressed more broadly, but I would certainly, I think we are very fortunate to have Ms. Lapine in the room right now, that if she wishes to add some comments on to what Chief Nolan has said, I would certainly invite Laura at this point.
Thank you. And through you, Chair, to committee, it's a very, important comment and question. And I think what my colleague Chief Nolan has outlined really does depict what we are seeing on a daily basis. We have dedicated staff who work within the Built for Zero, which is a very collaborative table that is very much like a situational table that the police offer, but the Built for Zero looks at each and every person who we engage in our program to look at the multitude of supports that they need, because homelessness is a very complex situation. We have to really be mindful of the picture of homelessness. There's acute homelessness, which is a situation that happens that somebody is suddenly without a home, and then there's those who are unsheltered for a long time or who re-enter several times. So, we run an after-hours support service as well, where between the hours of 4 and 10, anybody who's in need of sheltering can call us. We'll get them to a proper place like a motel, hotel, get them some food so that they're stable for the night. And then the next business day, they meet with a caseworker to start that journey of working towards, building a more sheltering picture. But we do know that there's a lack of really affordable housing, so it requires a lot of people at the table. We do have stats that we're collecting because we just completed what's called a by name list, point in time count, which is a requirement under the Ministry of Municipal Affairs and Housing to take one day and survey the county to really get a picture of what homelessness looks like on that day. And we're just pulling, that just took place, so we're just pulling those stats together. But we are finding that the work in terms of assisting people who are homeless, whether they come to us directly, whether they come to us through other agencies, is very complex work and work over a period of time. We're really thankful for the partnerships that we do have with the mental health teams here in the county. They are phenomenal. They do a lot of work with people. We have as well Family and Children's Services and their Safe Shelter for Youth programs. There is a program through policing that really reaches out as well. So I think there's we can't say it's not happening because we clearly know that homelessness is an issue, but each and every case is unique in its own and has lots of different layers. And sometimes we have some, quick wins in terms of getting people connected. Others take a long period of time. Thank you.
Thank you so much for that, Ms. Lapine. Anything further on item 7, community paramedic program? I thought rather than as item number 1 as the bookends to the information report, they are both associated with Commander Hultink. Wish to extend commendation on her outstanding efforts and acknowledge once again the culture of innovation that exists within the County Renfrew Paramedic Service. And I think, given the discussion earlier of the presentation to the German rescue service, I think it is once again identifying that a center of excellence, a center of expertise, is being inculcated, is being developed within the County of Renfrew Paramedic Service, and I think that that is perhaps demonstrating that the centers of expertise can exist across the County of Renfrew, and I certainly think that that's perhaps a challenge as we embark in our next strategic plan, hoping to be part of that, fingers crossed, see how things go in a week and a half or so. But I think that this is demonstrating that does not require one to live in the big city, so to speak. Centers of excellence are responding to the needs of their own community, and I think that is the blueprint for how we can move forward. So please extend Chief Nolan commendation and congratulations to Commander Hultink for the recognition of her expertise in this field. With that, then, moving on to resolutions, please, Chief Nolan.
Thank you, Mr. Chair. Item number 8, resolution, is related to the Roma delegation request, and that Health Committee recommend the County Council approve the submission of delegation requests for the Roma conference with the Minister of Health for the Renfrew Ipac Virtual Triage and Assessment Center. So there's a background there for you, and this is all pointed towards the Rural Ontario Municipal Association Conference in January to be held in Toronto. So the deadline for submissions will be in mid-November. So we'd just like to get ahead of that with this committee and council to submit those requests. Would you like me to go to number 9 or pause
No,
there?
we'll pause at 8. I would invite a mover for the recommendation, please. Councillor Emo, seconded by Warden Robinson. Any further discussion? Warden Robinson.
Thank you very much, Chair, and I do apologize for having to leave the meeting. I had indicated earlier that I had sent a message to MPP John Yakubuski about my request to meet with Minister Jones. As usual, John responded very quickly. That was the phone call, and he has been speaking with Minister Jones and her staff, and he is working very hard to try to ensure that we do get to have a meeting with the minister and her staff, hopefully prior to Roma, hopefully in the next 42 days. But so I just want to let people know that MPP Yakubuski is definitely on board with this, and that in his opinion, VTAC is the #1 issue right now that we need to deal with in his riding.
Enormously pleased to hear that, Warden Robinson. I know that Warden has advised me in the past, too, that she finds by the time she has to leave, if I drone on and on, so I thought perhaps that might have been what had prompted your vacating the meeting briefly. In any event, I think that it's important to, in the vernacular, keep the pedal to the metal. As well, I look forward to a direct discussion with Minister Jones on this, but I think it's imperative on leaning as far in as possible that it is still absolutely in our interest to pursue this delegation request. Anything further? Councillor Emo.
Thank you. Just a small infomercial. The Roma conference is held January 22nd to Tuesday, January 24th. It's at the Sheridan Center. You can go online in the next couple of days to request a delegation and your room for the conference, and the price is $595, which is a real bargain. There will be 16 concurrent sessions. We'll be deciding what they are on Friday of this week, so I'll have more information at the end of the month.
Thank you, Councillor Emo. Anything further? Warden Robinson.
Thank you, Chair Donoghue, through you to Councillor Emo. If Roma's looking for workshops and topics, I'm going to offer, because I'm not going to be here, but I'm going to offer that perhaps VTAC would be an excellent opportunity to present at Roma, talking about the impact, and certainly the physician shortage is a big issue, and again, this is one of the many tools that municipalities can use to assist people who do not have a family doctor.
I can assure you that that's part of the conversation on Friday. I have 2 items that I brought to will be bringing to the board, and VTAC is #1.
Thank you both to Warden Robinson and Councillor Emo. Anything further? All in favor? That is carried. Thank you. And with that, back to bylaws. Chief Nolan.
Thank you, Mr. Chair. Through you to members of committee. The recommendation is that Health Committee recommend to County Council the adoption of a bylaw authorizing the Warden and CAO to sign the educational affiliation agreement between the County of Renfrew Paramedic Service, County of Renfrew, and the Justice Institute of British Columbia for the preceptorship rideout of Canadian military search and rescue technicians with the County of Renfrew CR team and CPRU paramedics. If I could provide some background to that, Mr. Chair.
Please do.
And the background on this, as you know, our CR team works in very difficult places. And one of our fairly consistent stances as it relates to the work that the CR team does, so you can imagine if they were in the hinterland behind Calabogie, for example, with someone with a significant head injury or back injury, or has some level of musculoskeletal instability, really the way that it's working, just so that we're all kind of pointed in the same direction as it pertains directly to this partnership, and that is the Sierra team have become exceptional at inserting themselves into very difficult places where other people have found themselves typically broken. We can get in there safely, we can stabilize their care, and more often than not now, the Sierra team is working directly with the search and rescue technicians of the military from Trenton, who will come overhead will rappel or parachute into the location, will continue to transfer care with the paramedics, will collaboratively load that patient into their basket, and then that patient and a SARTAC will be hoisted into the helicopter and directly to the trauma center or the most appropriate facility for that individual. Then the paramedics can typically make their way out of the bush, having provided the care, the stability, and the coordination in a extremely safe, predictable, and reliable manner so as to manage risk and to optimize the care that's being provided. On a number of occasions, the Sierra team have had to spend the night in the bush, awaiting weather, awaiting alternate resources, and provide exceptional care in very difficult circumstances and be able to navigate the realities of those situations on their own, which is why our Sierra team is the team for Ontario Parks, for Algonquin Park, and is routinely deployed to difficult situations within the county and many of the portions of the county. Certainly Head Clare Mariah would be a good example of some difficult to access areas where we've got logging operations and we've got other things going on. So this isn't a relationship or partnership of convenience. This is about they give us an exceptional service. We give them an exceptional service. Now we need to cross-pollinate our knowledge and our understanding of our operations to a deeper level, as we do on an annual basis when we meet with the park superintendent, the JRCC or the search and rescue folks, and the park warden. So this is just a good illustration of how we're trying to take it to the next level, formalize the relationship, and have a quid pro quo in terms of the knowledge translation.
Thank you very much, Chief Nolan. Once again, I would seek a mover, please. Warden Robinson, seconded by Councillor Doncaster. Discussion, questions, comment. I think that this is an outstanding initiative, certainly in keeping with the earlier comments. Did extend into reviewing the terms of the agreement. Certainly note that it is extensive and comprehensive, and very pleased, obviously, a great deal of consideration was given into the actual terminology contained in the agreement. So I think that this is, as the Chief has said, the opportunity for knowledge exchange, the cross-pollination. I think it's outstanding, and I think that this is absolutely in the interests of the County of Renfrew and the County of Renfrew Paramedic Service. With nothing further, all in favor? That is carried. Thank you. At this point, then, I would seek a resolution to adopt the Emergency Services Report as a whole, please. Councillor Murphy, seconded by Councillor Bennett. Once again, any further and final opportunity for question on any component? Seeing none, all in favor? That is carried. Thank you. Bear with me as I'm clicking about on my agenda. The next item is the Board of Health minutes. They can be found on page 38 of your report package, committee. This is from the August 30th, 2022 Board of Health meeting. Should you have any questions, I will endeavor to answer them to the best of my ability. Warden Robinson.
Thank you very much, Chair Donohue. And not directly about the minutes, but Board of Health related. At the Development and Property Committee yesterday, we learned that the Health Unit has decided to vacate Renfrew County Place as of June 2023. I asked at that time, and we really didn't have an answer as to why they were leaving. But the concern, I think, for this committee in particular is that going to be a loss of service to that section of the County of Renfrew? So what I would ask is that perhaps committee consider directing the warden to write a letter to the chair of the Board of Health asking for clarification about what is actually going to happen down in Renfrew. You know, people expect those services in all parts of the county, and if they are leaving that area, and I want to make sure that our residents are still receiving the services and supports that we as the County of Renfrew help fund. Thank you.
Thank you for that. Councillor Emo, I see your hand up.
Thank you. And yesterday, when asked a question, I wasn't as well prepared. And if I could ask our friends in the back, and they have listed it. So this is the report we received from the Resources Committee to the board without notice. We weren't aware that the lease was even under discussion. It just showed up on the agenda with this recommendation, and we asked that it be removed and voted on separately, and a recorded vote lost. And so you don't see anything in the report when you scroll down. You don't see anything. Those were the bullet points that were presented to the board. And so there's nothing about service levels. So I don't know if 1,000 people were served by that office in a year, or 12,000 or 2. I don't know what programs were served out of that office. I don't know if there's been an increase or decrease. I don't know that there's been any consultation with staff or other service providers in the area about partnerships. I do know in the space they occupy, they're adjacent to Ontario Works, probation, childcare, and so those are the people that I would assume that the health unit would work with, and in fact I've seen reports in the past where they've worked with them. So I'm curious as to what went into making the decision. Now, these were the bullet points. None of them speak to service, and none of them speak to continued service. So I'm a little concerned about that, and asked those questions. Didn't receive anything of any value to my mind that reassured me that they were going to be able to continue serving the community and what the fallback plan was. So voted against it. Will continue to speak against it, and would endorse and request that the County of Renfrew and the municipalities in the Renfrew area also ask questions, because I would think Town of Renfrew, Township of Horton, Amherst, Bromley, Greater Madawaska, Whitewater, Bone Shire Valley, and McNabb Braeside and Arnprior all, to some degree, get some services from that Renfrew office. I would note, in speaking with Mayor TJ yesterday, because she was asking me about the criteria as well, and I couldn't offer anything, we did note that when Renfrew County and District Health Unit was searching for a medical officer of health, one of the things that was considered was fitting up the Renfrew office should a successful candidate wish to work closer to the Ottawa area. So that, by arbitrarily closing the office while they're starting on a search for a medical officer of health, doesn't make any sense on top of that as well. So there's service issues, as well as just being able to provide oversight and governance. So I'm not saying it's the wrong decision. I'm saying there was incomplete information provided. There was a knee-jerk reaction, seemingly because the calendar told them they had to, under their contract with the landlord, had to suddenly make a decision. And in 4 days, up pops a report, very incomplete. It doesn't give you any information, and it doesn't reassure the community. Thank you.
Thank you, Councillor Emo. Perhaps I can illuminate a little further. There were, at the board meeting, and as committee is aware, the minutes, this was a recorded vote on this particular question. The minutes from that Board of Health meeting will come forward to the Board of Health for approval at the end of this month. Those minutes then will not come forward to the county. I think that the only business at the inaugural is, in fact, the inaugural meeting. I do note that there is some business, I think, in December. I'm not certain if there is an anticipation. So I do thank you, Warden Robinson and Mr. Kelly. You noted that the disclosure of the intent to vacate came forward through the development and property. So those minutes would not be coming forward. So this is timely to be able to address this here. So in perhaps expanding a little bit on Councillor Emo's comments, the lease for Renfrew County Place contained two clauses that were very parallel, though not the same. There was a requirement, there was only a 6-month notice of intent to vacate. So that would have been required at December 30th. What was required at the 9-month mark was whether we wished to renew. And ultimately what the renewal was, there was a pretty significant negotiation at the time that this lease was extended, I believe in 2018, for a 5-year term. Ultimately what the renewal would do is, if both parties were satisfied with the terms, they would essentially endure and no further negotiation was required. So there certainly was a requirement as of October 1st to provide the county notice of whether the Board of Health wished to renew the agreement, wished to extend the agreement for a further 5 years. There was not a requirement at that point to notify of an intent to vacate. I had brought that forward to the board at our meeting at the end of September. As Councillor Emo has suggested, the first I became aware of this even being under consideration was when I received my board package on the Friday prior to the meeting, which would have been the last Friday of September. So there was, basically no time given the October 1st deadline of notice of intent to renew, that something had to be done at that point. That is still, in my estimation, not fatal or did not necessarily imbue my decision in following up once again on Councillor Emo's comments. Of the 9 members of the Board of Health present, 2 were opposed to moving forward on this recommendation. Those 2 were Councillor Emo and myself. As Councillor Emo has suggested, I do not know whether this is the appropriate decision. That is my challenge. It was why I was not in support of this resolution. The entirety of the information that was provided to the Board of Health is on the screen right now. I don't know what space costs means. I do know that it was something on the order of $45,000 plus utilities, et cetera, was the cost of occupying that space. There was no information provided as to what alternate space in Renfrew might be, how this particular leasing rate compared to other leasing rates. That was not forthcoming. As to the different business model, there was no information forthcoming on what that meant. There was a discussion that it is oriented more towards hoteling of staff than clinic area, but there was nothing provided. So, in my estimation, I did not have nearly sufficient information to be able to make a consequential decision, not simply to not renew the lease, but in fact to vacate the premises. I will contrast that with the process that was followed when the County of Renfrew initiated the modernization or the renovation of the County Administration Building here where we sit in 2019, which was going to repatriate primarily, I believe, the community services back in to a single community. There was an extensive investigation and report brought forward of what the costs would be, what the payback period would be, et cetera, what rationalization we could achieve, to the point where everybody in this room is aware that I think if not 2022, in 2023, we will begin paying back $466,000 a year in savings that will go against the costs. Likewise, when the Board of Health received the notice from your predecessor, Mr. Kelly, Mr. Morrow, advising of that process, but with no particular date in mind, actually, the Board of Health at that point engaged in an accommodation review, an accommodation working group to identify what the needs were going forward. That was we received that notice in January of 2019. The consultant that was engaged for the accommodation working review that did do an extensive engagement on what was the opportunity for remote work, what was the opportunity for hoteling, et cetera. In that engagement, it was September before they actually delivered their report on what was the requirements moving forward. This was almost 9 months from when the notice came forward that the Board of Health may have to either utilize a smaller footprint at the county administration building or vacate, seeking other accommodation. So the fact that it was an extensive engagement of an outside consultant certainly stands in stark contrast with the very brief and, in my estimation, wholly incomplete rationale for the decision that was made. As I have indicated, I cannot know. The chair of the board did identify that at the Resources Committee meeting, there had been a PowerPoint presentation and that there had been an extensive discussion. Neither of those things apparently was seen fit as to be required to come forward to the Board of Health. So ultimately, in answer to your question, Warden Robinson, this may be a very good move. There may be an alternative that staff at the Renfrew County District Health Unit have identified that is going to be a much more efficient delivery of service, et cetera. The challenge for me today and the challenge for me at the Board of Health meeting is there is nothing provided to me that informs me of what that would be, and it was for that reason that I could not support the motion. So all of that comes around to the point whereby I absolutely would support a correspondence be sent over your signature, Madam Warden, inquiring about what would continue to be what has been the service that's been provided there, and ensuring that whatever services the kind of southern end, I suppose, if you will, of the district that is Renfrew County and District would continue to be fulfilled. We did not hear that at the Board of Health. I think that it is incumbent upon us, certainly through this committee and over your signature, to inquire to ensure that that is so. Warden Robinson.
Thank you. And so just so we're clear, in case there are people on the Board of Health watching what I saw on Twitter as the most popular committee that people watch from the County of Renfrew, is that I'm not suggesting that the County of Renfrew insert itself in the business of the Board of Health. That's the board members' issue and to deal with whatever they decide about leasing. Our job as municipal politicians is to ensure that the services that our taxpayers are paying for are being delivered, and that is the sole reason that I want that letter to be written, and we need to find out from them what is happening for the residents of, in particular, that portion of the County of Renfrew.
I am in complete agreement, Madam Warden. As a member of the Board of Health, the die is cast, the vote was taken. The position shared by Councillor Emo and myself in our capacity as board members did not prevail. So the decision has been made, but in answer to why that decision was made, that is why I provided the background of the concern that I have that were not addressed at that point. So thank you. Anything further? Councillor Emo.
Thank you. I'm sorry, I forgot to mention one other point. Unfortunately, the meetings aren't recorded and broadcast, so you can't go back, so I'll have to go from my memory and my notes, which are nearly perfect. One of the things that was concerning for me was the desire to tie their wagon to the Ontario Health Teams, which, to my understanding, won't be formed sufficiently enough by January or by the end of June to be of any value to provide service. So that I pointed that out. There was a chorus of crickets, I think I heard, but there was nothing beyond that. So we'll see.
Thank you, Councillor Ewan. I'm assuming that the perfection was in reference to your notes, not the latter. Okay, thank you. Anything further? Warden Robinson.
I am looking for a motion from someone to suggest that our warden send a letter. We don't have that yet.
Councillor Emo, you are prepared to move
yes,
that
I am.
a letter be sent? Seconder, Councillor Murphy. Any further discussion? Councillor Murphy.
Thank you, Mr. Chair. I was feeling a bit invisible back here. Just to be clear to this committee, I had a conflict in my schedule and was not at this Board of Health meeting, but I really appreciate the background because I read it in my package and I didn't understand it. And if they're going to tie their wagon to the Ontario health teams, well then don't we have one health team in the southern end and then Network 24 in the northern end? I don't really understand how closing down Renfrew serves that purpose. But certainly I think that's good background to have. Thank you, Councillor Emo.
Just if I might, for the record, what formerly was Network 24 is now the Ottawa Valley Health Team moving forward. I just wanted to provide that clarity. So we have it moved, we haven't seconded. Warden Robinson.
I just want a clarification of the motion. The motion is this committee is going to recommend to County Council that the warden send a letter, correct?
That would be the appropriate process. Thank you. Yep. So, Mr. Kelly, we didn't hear a specific wording, but it is to the gist of the motion that was duly authorized. Would be to recommend to County Council, direct that the warden correspond with the Board of Health, with the chair, whatever the appropriate addressee, just inquiring as to the continuation of the provision of services that have been delivered out of the office at Renfrew County Place. Is that sufficient? Do we need the specific wording for our resolution recommending this? Mr. Kelly.
Thank you, Chair, and through you. So, yeah, the gist that I wrote down is not much different. Was that the health community recommended to County Council that the warden write a letter to the health unit, broadly, to determine if and how the decision to not renew the lease at Renfrew County Place will affect the health unit services in the County of Renfrew.
In the absence of anyone that is vehemently opposed to Mr. Kelly's wording, I think that we can take that as the appropriate wording. Is that consistent with the mover and the seconder? The nods affirm that it is. That is the resolution that is before us. Now, any questions, comments on the resolution before us? Seeing none, all in favor? That is carried. Thank you. Any other questions on the minutes of the Board of Health meeting of August 30th, 2022? Seeing none, I believe I'm seeking a motion to accept the minutes of the Board of Health meeting of August 30th, 2022. Councillor Emo, seconded by Councillor Lafreniere. Anything further on the minutes themselves? Seeing nothing, all in favor? That is carried. Thank you. With that, under new business, I want to take an opportunity. There are two specific items that I wish to address. The first is, it was just recently out in the press that Ms. Sabine Mersman is to be the next CEO for Pembroke Regional Hospital. So I think that it's important to both congratulate the outgoing long-term. I actually had occasion over the weekend at Shaw Woods to encounter Mr. Noel and commend him on his 16 years of service to the community and to the health community at Pembroke Regional Hospital. I think it's been an outstanding contribution towards our community. The other thing that I think it is incredibly important to recognize and celebrate here today, when I took my seat here, each of the four CEOs of the hospital sector within the County of Renfrew were male. When in fact Sabine Mersman occupies the office of CEO, they will all be female, all four of them. So I think that this is cause for celebration, that we are moving in the right direction, and commend, I did actually have to bring them up in front of me to commend Leah Levesque and Julia Boudreau and Jenna Hodson and now Sabine Mersman, who will be the four CEOs in the hospital sector in Renfrew County. And I think, in fact, if you would join me, even though not present, in a round of applause for this significant moment. The other thing is, this is the final committee meeting, not just of this year, but of this term of council for the Health Committee. And I want to extend my absolute appreciation for beginning with staff who are always incredibly prepared. The reports are extensive. I think it is largely the reason why there are not a lot of questions generated here. The incredible professionalism of staff is to be commended. It has been a unique privilege, and I thank the warden for the trust and confidence that she has shown in me to chair this committee now for, well, since March of 2019, however many months that has been. It is certainly my fervent desire that I have even remotely approached the level of confidence that she has had in me, that I have responded in kind. And then finally, I wish to thank committee. I think that there has not been a single meeting where the committee has not demonstrated their absolute preparation to engage completely in the health needs of our community. And I think that that is what truly has allowed us to make significant gains. I think that particularly over the last 4 years, amidst the sword of Damocles, if you will, that has been COVID and the incredible challenge that that has provided, not to this committee, but to all of the things that this committee oversees and reports through. The enormity of that challenge cannot be overstated. So with that, it is with deep appreciation for everyone's contribution and commitment to this committee, commitment to the County of Renfrew, the corporation of the County of Renfrew, but most importantly, to the residents of the geography of the County of Renfrew, inclusive of the City of Pembroke. I think that this has been outstanding, and I thank you for allowing me to be a part of this. I'm going to go to the warden first, and then I will come to Councillor Lafreniere.
Thank you very much, Chair Donoghue, and I as well have 2 items. The first one is, again, while I was out, I did want to comment on the Exemplary Service Awards. I know the Chief had suggested bringing the 2 paramedics in at some point. I would be very pleased if there was an opportunity to bring them to the October 26th County Council meeting, the final County Council meeting of this council. If that's possible, that would be just absolutely a wonderful opportunity for this council to say thank you and congratulations. My second, of course, is the fact that you are chairing your last health committee meeting. I couldn't have chosen a better person. You talk about the staff being prepared. No one else wanted the job, but that aside, when we talk about being prepared, I mean there's not a councillor, and I include myself among that come as prepared at County Council and at the committee meetings as well, and certainly the vocabulary of every one of us hasn't been improved over the last 4 years. Oftentimes I'm writing down names or words so I can check later as to what the hell they meant. But anyway, honestly, you are an extremely great colleague to have, and thank you so very much. I wish you the best of luck, and I do hope that you are returned to office by your voters. So thank you again very much, Michael.
Thank you so much, Warden Robinson. You are so very perceptive that almost every position I've ever held is because everyone else stepped back when I was too silly to move. Councillor Lafreniere, you also had your hand raised.
I'm just going to jump on this bandwagon. So I just want to say on behalf of the City of Pembroke, I want to thank Warden Robinson for her leadership, insight, and her passion to serve not just the residents in the county, but in partnership, obviously, the citizens of the City of Pembroke. I've admired your work, your stamina, and you really do have passion, and I haven't been keeping track of how many times you've said VTAC, so you're safe there. But thank you again, and good luck on your future endeavors, and I'm sure you will be missed at many levels. Thank you.
Thank you. Actually, as a colleague Warden Robinson, I will say, well, you're the warden, of course they can come to the meeting. What you say goes. Chief Nolan.
Yeah, thank you, Mr. Chair, and I appreciate the opportunity to address committee because I feel like today is, in some respects, the end of an era. And if we think about our collective experience of working through what is arguably the most challenging 4 years in the past 50 anyways, we have done the yeoman's work in terms of having to embrace the unbelievable, having to navigate the unconscionable, and having to embrace a population who has been incredibly receptive to the guidance, to the ask. We've asked virtually everyone in this county to get something stuffed up their nose over and over and over again. And people lined up. People were upset that they had to wait to have this unconscionable thing done to them over and over and over, and not to keep them safe, but to keep their family safe, and to keep their community safe, and to keep our economy running, and to allow us to vaccinate them en masse in an unprecedented way, and seek the guidance of all of you in these chambers in terms of what is right and what is wrong. We had many a late night or weekend conversation about, should we be declaring an emergency or should we not? Should we be lifting the emergency or should we not? What message is that sending to your constituency when we're on again, off again? And do we just hold our breath and wait for the next policy to come out? Because again, it's Friday afternoon at 4 o'clock and everything's supposed to be done, before midnight. Are the kids going to school or they're not going to school? Employers, CAOs have had to wrestle with, what is our attendance policy? Who's going to work from where? How do we keep the rubber on the road? To how do we keep the lights on and one desk open should somebody need to knock on our door? These are phenomenal things to wrestle with. And I think we've all, under the guidance of the chair, the warden, and all of you, benefited from your steady hand in terms of trying to navigate that in practical ways, navigate that with your home communities and councils, but also be able to wrestle with that internally, right? We have all had a degree of moral trauma, knowing that the things that we held on to as liberties, that we held on to as assumptions, that we held on to as security, were stripped away one by one, not by you, not by government, but by the reality of a disease that took many lives in our community, despite our best efforts. And when I think about the toll that that has had on you emotionally, the toll that that's had on you physically, socially, it is truly unconscionable. And I want to thank each and every one of you, the chair, the warden, and all the staff and all the residents of Renfrew County for your support, for the unwavering commitment to doing the right thing all of the time, and to being the leaders that this community has needed 24 hours a day, 7 days a week, since the beginning of the pandemic, the beginning of your term, or throughout your political career. Because that is what makes us stronger as a community. That's what makes your staff truly understand and believe that someone cares about them, that somebody has their back. We had to make many decisions, both in long-term care and in the paramedic service, that we never thought we would have to make. It's brought us closer together. It's terrified many of us at different times. It's made us sad. It's made us contemplate who we are, what we're doing, and why we're here. So for that, I want to thank each and every one of you, on Michael and my behalf, on behalf of the CAO and all the staff here, for your guidance. There's a reason we're the #1 channel, and I think it's because of what the universe has brought us as a challenge, and the way that we have attempted to deal with it head on through adversity on every possible level. So with that, thank you, Mr. Chair, thank you, Madam Warden. I can't say enough on behalf of the paramedic service and on behalf of, the staff at large, this committee, being responsible for both emergency management and the health of the community, has been there, has shown up. And when I look in the rearview mirror, I could not be more proud of the work that we all did together to be able to keep our community safe. So thank you.
Thank you, Chief Nolan. Mr. Blackmore, please.
Thank you, Mayor Donahue. I'm the more brief mic of the three mics, so I'll keep this as true as my reports. I just want to take the opportunity to thank everybody for their assistance in helping me out, and as a novice in this position over the last couple of years, over what has been, as Mike has alliterated, just an incredibly challenging time for everybody. You as the elected, Warden Robinson, Mayor Donahue, just the being able to call upon you over those weekends, wondering what to do next, as it were, with regard to the latest direction to give families and what have you, in accordance to the provincial policies. Your support of the staff and families always being the number one priority in the hearts of committee. I just thank you so very much. You've made this what has been a very challenging year that much easier to manage with your guidance. So again, thank you.
Thank you as well, Mr. Blackmore. Very kind words. I think in the end, if I might, I do not believe that COVID has built character. I think that COVID has revealed character, and I'm incredibly proud of the entire community, all those that we have spoken of here today. So thank you to everyone. With that, there was no closed meeting, Mr. Kelly, at the time of mailing. Does that continue?
Yes, it does, sir. No closed meeting
today.
today.
With that, then, the date of the next meeting will be at the call of the chair, perhaps, or at the direction of the next term of council and the warden therein. In any event, I would seek now a motion to adjourn, please. Councillor Bennett, seconded by Councillor Grills. All in favor? That is carried. Thank you to all of you.